Trust me, I'm going to emphasize on, and that's how I felt. I was shivering. I felt I literally just finished lecturing my friend about taking his drugs. The moment it gets to that strength, that power to actually attack your body, it's not just going to attack your body, it's going to attack your red blood cells. Suddenly, the wound starts breaking. And that's how malaria parasites hide, grow, and then bust your red blood cells. And that's when you start shivering like you're going to die. Hello everyone, how are you? How's everything? Today is day one of releasing content for 90 days, and today we're going to be talking about malaria. This is the most popular illness in Nigeria. I'm sure if you haven't experienced malaria in your life and all your life is in Nigeria, well done. I'm very happy for you because recently I went through malaria and it wasn't funny. Honestly, it wasn't funny. I was shivering at 3 a.m. and being that I'm not at home, I was crying just looking for my mama. It wasn't funny. Hi, I'm Professor Fatima Nasiru, and today I'm going to dissect malaria for you. I'm going to tell you how malaria is formed, how the drugs work. I'm going to tell you why you are given paracetamol, and I'm going to tell you how to properly take the malaria drugs before or after food, and also why you get all the pains even after you finish treating malaria. Let's get down into it. The first thing we're going to talk about is how is malaria formed. Malaria is formed when a mosquito bites you. The parasite Plasmodium is going to travel from wherever that mosquito bit you to the liver. So when it gets to the liver, it's going to just settle and get cozy and just start, reproducing and keep multiplying and multiplying and multiplying. And that's why that it's going to actually do that within the period of 7 to 14 days. The moment it gets to that strength, that power to actually attack your body, it's not just going to attack your body, it's going to attack your red blood cells. So when it attacks your red blood cells, it's going to start busting your red blood cells, and that's when you'll feel fever, you'll feel pain, and you'll feel headache. And that's how I felt. I was shivering. I felt headache. Actually, I didn't feel the headache first. I felt chills, and then I was shivering, and then I felt like I was dying. It did it all at once. So now, how does the drugs work? The drug work by stopping that multiplication. So the moment the drugs like artemether, lumefantrine, p-alaxin get into your body, they stop the parasite from multiplying inside the red blood cells. Once the parasite can't grow and burst your cells, the infection slows down and your body starts to take over again and recover. I have an analogy here. It says that it's like termites in a wooden house. First, they hide inside, each quietly, and then suddenly the wood starts breaking. And that's how malaria parasites hide, grow, and then bust your red blood cells. And that's when you start shivering like you're going to die. Anyways, let's move into why you're given paracetamol. You're given paracetamol to help with the pain, and doctors give paracetamol when you're taking malaria drugs just because they know you're going to be having headache, you're going to be having fever, you're going to be having body aches. So it's going to help in making sure that you don't feel those pains. Especially paracetamol is one of the easiest thing to give, especially the fact that even if you have ulcer, you can actually take paracetamol. And let me get one thing straight. Paracetamol doesn't kill malaria. No, it just helps you with headache. So don't get malaria and then go and just be taking paracetamol because I've seen it happen. You need malaria injection or malaria drugs. Paracetamol is not going to help with your malaria. Just saying this is giving me a headache, which means I have to take paracetamol after this. How to take malaria drugs? If you are given any, I'm going to explain these drugs: Amatem, Quatem, Lonat or Lomatem, P-alaxin or Cortexin, yes. All these drugs, if you're given Amatem, usually it's given in one capsule. Quatem is usually given in 2 or 4 tablets. Lonat or Lomatem, okay, Lonat, Lomatem, Quatem are given usually in 2 or 4 tablets. P-alaxin or dual Cortexin is given usually in one tablet. So if you're given Amatem, Quarten, Lomaten, or Lonat, you're supposed to take the first dose immediately after you finish your injection. Or if you have not been taking any injection and you just start malaria drugs, because sometimes the malaria might not be that severe that you need injection. So if you didn't take any injection, you can just start with your first dose of one of these drugs. After taking the first dose, you're supposed to take the next dose at after 8 hours. So for example, let's say you take the first dose at 8 a.m. You're supposed to take the next dose at 4 p.m. And then you won't take another dose until 8 a.m. again the next day. That is the third dose. And then the fourth dose is going to be at 8 p.m. Your fifth dose is going to be at 8 a.m. the following day. And the sixth dose is going to be at 8 p.m. And that's it. And then the next day, if you're given anything like vitamin C or you want to eat your fruits, you can go ahead and do it the next day. You will not take it until at least 12 to 24 hours later for vitamin C. So the important part is to always make sure you follow your doctor's prescription, finish your doses, follow the exact information your pharmacist is going to provide you with. And if it says you should take 2 tablets or 1 tablet, do as they say. Please do not overdose, or do not say, oh, I didn't take it earlier, let me take 2 doses, double the dose. Don't do that. And also remember that if you are taking malaria drugs, please and please make sure to include some fatty foods into your diet. Make sure to include foods like pap, milk, rice with oil, akara. These are going to help the malaria drugs to get absorbed into your system. And if you're taking the malaria drugs, you're not supposed to take it with food, and you're not supposed to take it before food, because if you take it with food, the food is not fully it's not fully absorbed into your body, and it's not fully digested for the drugs to actually be able to get absorbed more. But if you take it after the food, the food is going to help the body the body to absorb the drugs. But and also, if you take your malaria drugs before food, that malaria drug can actually make you feel more nauseous, and the drug might not even work. So just be careful on how you take your malaria drugs, Kungani. And the timing of the doses is actually very, very important. What I usually do is whenever I'm taking my drugs, I always make sure I put up a timer. So as I mentioned, if you're taking Quartem Lonat, if you're taking or Lomatem, you're supposed to take that dosing that I mentioned. But if you're taking P-Alaxin and Duocortexin, you're supposed to actually take it 12 hourly. That which means you're supposed to, if you take the first dose at 8 a.m., you're supposed to take the next dose at 8 p.m. And you're going to do that the next day, you're going to do that the following day. You're not supposed to take it just like how you're supposed to take Amatem, Quartem, Lonat, or Lomatem. I'm saying the names and looking at them because they are brand names, they are not the generic names. So consistency is actually everything when it comes to drug taking. One of the biggest mistakes that people do is the moment you feel better after one or two doses, 3 doses, they stop taking the drugs. And to be honest, that is the most dangerous thing you're ever going to do to your body, because when you're taking the drugs, the parasites are still inside your body. So if you stop, it grows back. So the next time you're actually going to take your anti-malaria drugs, they might not work for you. You know why? Because you have developed an anti-malaria for resistant for that particular drug. So you have to be very careful. Whenever a doctor gives you a prescription and your pharmacist gives you the directions and everything and tells you the do's and don'ts of how to take these drugs, make sure to actually take them and do not allow your body to get anti-malaria drug resistant, because that will be the most dangerous thing you'll ever do to your body. That's how we see patients coming into the pharmacy saying they want malaria drugs, and you'll pick up like 3 or 4 brands of malaria drugs to give them, and they'll be like, this drug doesn't work for me, this drug doesn't work for me. In fact, I've even seen it in patients. When I was doing my internship back in, I believe it's 2018, no, 2017, there were these parent patients that came. They were all treating malaria, including their kids. The kids were twins. The girl was taking her drugs normal and all those things, and it was all good. And the boy was already resistant to two types of malaria drugs. And why is that? After my superior pharmacist, actually senior pharmacist, finished explaining everything to them, he turned back to us and explained everything to us. The boy has already developed anti-malaria resistance to two of the drugs, and it's not working for him. So he had to go for another one. Whether it's an anti-malaria drug or anti-malaria injection, just make sure you finish your complete dose, because trust me, I'm going to emphasize on this. Finishing your complete dose, the whole course of your injection or your drugs given to you by your doctor, is very, very important. I literally just finished lecturing my friend about taking his drugs, and honestly, he called me to ask for directions for some drugs, and after that I still emphasized, because they're antibiotics. Finish your drugs, finish your drugs, finish your drugs. And to be honest, it's very, very important, extremely important. Next, we're going to talk about why your malaria drug is not working, why you're not getting better. Yes, let's talk about that, because so many people are sitting comfortably in this on this table. Let me tell you, you go to a hospital. Whenever there is a patient at the hospital, for us culturally, I don't know the houses, this is how we do it. When there is a patient in the hospital, whenever we go to visit that patient, we'll take a bunch of stuffs for the patient: water, drinks, fruits, so many types of fruits, and all those things. And what I realize is, every time I go to the hospital, those looking after the patient are always encouraging the patient to eat something. And especially when the doctor says, try to give him something. And if you're dealing with malaria, if anyone gives you a bowl of fruits that's either oranges, pineapple, watermelon, lemon, tangerine, or grapes, don't accept that. Don't accept it at all, because trust me, those drugs are actually not going to allow your malaria drugs or injections to work. Those fruits, sorry, those fruits are not going to allow your malaria injections or any drugs to work, because they contain vitamin C, and vitamin C have an antioxidant activity that, if I go deep, it's not going, we're not going to finish this. If I go deep, honestly, it's a whole story, but it have an antioxidant activity that won't allow the drugs to work the way they're supposed to work. So avoid those kind of food. Instead, you can just make sure to eat your fatty foods, take your drugs after you eat, take your full course of injection, take your paracetamol if you're feeling pain or headache or fever, and that's all you need. That's all you need when it comes to malaria. Quick do's and don'ts. A recap: always eat before taking your malaria drugs. Take the drug after food, not before food or with food. Do not do that. Fatty foods make it work better. I've told you, fatty foods make your drugs work better. And complete the full course of your medication. Do not stop halfway. And avoid vitamin C. Anything containing vitamin C, and as I mentioned, the fruits will stop your treatment, and just make sure you take it after you finish your treatment. And if you vomit within 1 hour of taking your anti-malaria drugs, make sure to take them again, because it's very important, unless the doctor says otherwise. And protect yourself from mosquito bites. Spray your rooms, apply anti-repellent creams. They're everywhere now. Make sure, even if it is those malaria, mosquito sticks, put them everywhere. Step out of the room. Make sure the room is well ventilated before you come back into the room. It actually works. This are all the steps you need to know when it comes to malaria. To be honest, I wish I can actually talk more about malaria, but it's already out there. And if you know you're experiencing malaria and this video was helpful, being a hausa, and this video was helpful to you, please and please give it a like. And if you know anyone that needs this video, or a family friend or a group of family that needs this complete guide when it comes to malaria, please send it to them, because we all need this highlight when it comes to malaria. We need to know how the malaria is formed. We need to know the history behind the malaria. We need to know what to do, what not to do when it comes to malaria. And don't forget to like, comment, and subscribe on this video so that we will be posting every single day, even though I'll be posting every single day. Wish me luck.